Welcome to the 2020 PDA Pharmacopoeia Conference. I am thrilled to introduce our speaker, Pam Traxel, Senior Vice President, American Cancer Society Cancer Action Network. Welcome.
Greetings. I'm so excited to be with you here today, albeit virtually, to talk about patient perspectives. 2020 has been an extraordinary year, and this conference is really important given the nature of our pandemic. So let's talk for a moment about what the pandemic has taught us. First and foremost, I think it's taught us the importance of stockpiling valuable supplies like toilet paper. How many times did we all think about what it was like to realize that we wouldn't be able to get toilet paper at our grocery store and we weren't sure exactly when we would be able to get those supplies? When we did go to the grocery store, it reminded me a little bit of some of the Eastern Bloc countries before the Cold War. A lot of shelves, not a lot on there. And again, a lot of concern about supply. When would we get more things? When would I be able to buy toilet paper? And last but not least, we learned a lot about quality. As you all are well aware, there's been a lot of discussion about the quality of hand sanitizer, making sure that the ingredients that are included in hand sanitizer is safe for people to use. The pandemic has really taught us a lot, and that's why this conference is so incredibly important. The quality and supply chain that Americans have come to expect has really been kind of put under a microscope now because of the pandemic. And so we've learned a lot, I think, about some of the issues that this conference focuses on. At the American Cancer Society Cancer Action Network, which is the public policy arm of the Cancer Society, we've actually talked a lot about what COVID-19 means for cancer patients. And so in the beginning of the year, actually in April, we fielded a study to talk with about 3,000 cancer patients about what COVID-19 meant for them in their cancer journey. And what we found, and what you see here on this slide, is that 55% of patients in active treatment in April were experiencing some impact to their care due to COVID-19. These delays were, in the early stages, a little bit hard to quantify. We had a group of patients who thought that their care was going to be delayed less than 2 weeks, with a small number of patients. We had a group of about 14% of patients who said they thought their treatment would be delayed more than 2 weeks. And then we had a group of patients who said, I don't know when my care is going to resume. So I think that was a really important point in the pandemic. We also saw a switch to in-person visits being transitioned to phone or video visits. We saw a lot of telehealth. And then we also saw prescriptions being delivered via mail or delivered. And again, this was very early days that we convened this study. I think one of the things that we learned is that this was the beginning of a transition in care for cancer patients due to COVID-19. So when we did a little bit more of a deep dive about the services that were interrupted for these cancer patients, not surprisingly, the first set of services that were disrupted were in-person visits with their provider. But we also saw a drop-off in supportive services and imaging services. I think this is really the first time that the American Cancer Society Cancer Action Network really began to understand exactly what a challenge COVID-19 would represent for the patients that we serve. And as we started to think through what this meant, we started to think a lot about how we could provide better services to cancer patients and their caregivers to make sure that they understood how they needed to prepare as the virus continued, how they could move their appointments to telehealth. In some cases, instructing patients how to move their prescriptions to mail-in prescriptions so that they didn't have to go to a pharmacy all the time. These were big changes for a lot of cancer patients who generally have a lot of contact in person with their oncologists and their care teams. So this represented a pretty dramatic shift. I think too, this also had a lot to do with people thinking again about the supply chain. how were they going to be able to get the supplies that they needed? If you can't get toilet paper, it does make you worry a little bit about access to medicines. If you're hearing that there are concerns about the quality of your supplies that you're getting at your grocery store, it does start to raise questions about the qualities of the medications that you're receiving. And I think we saw overall that there was a lot of challenge for cancer patients in thinking through what a pandemic meant to their cancer care. One of the largest takeaways that we received in our survey is really evaluating the financial impact on cancer survivors during this pandemic. So overall, we had almost 40% of our survey say that the pandemic represented a financial impact to them. These impacts are really long lasting. For us, this data continues to prove true in later surveys that we've done. And in fact, we just finished fielding a survey just this week that continues to mirror this data. So why are cancer patients feeling a financial impact during the pandemic? As you can see here from the slide, there are a variety of reasons, but generally it ties to the fact that most patients may receive their health insurance through an employer. And so they are concerned about work hours being reduced. If you're retired, you're worried about the reduction in the value of your investments and your ability to pay. You're very worried about food and supplies and the costs of staying at home. You've seen a lot of surveys talking about the fact that many Americans are paying a lot more money actually to eat at home than they normally do and had normally budgeted. And then, not surprisingly, we also are seeing quite a few people who have either themselves or a household member have lost a job due to the pandemic. I think the financial implications for cancer survivors for COVID-19 are quite serious. And again, this really ties back to their ability to think about how they're going to navigate their care. So when we think about the concern that cancer patients have about the financial impact of the pandemic, we also had done some work to talk about how over time did the pandemic impact their delays in treatment. You all are starting to hear a lot about delays in cancer treatment and what this might mean for cancer incidence and mortality in our country. So in a survey that we commissioned actually in May, we saw a dramatic rise in the numbers. So in this survey, 79% of these survey respondents indicated that there was a delay in receiving their health care. This is a pretty dramatic number if you compare it against our earlier survey. This is, I think, the thing that we are most concerned about as the American Cancer Society is how we can make sure that cancer patients resume their cancer treatment and get the care they need to battle their cancer. I think that this continues to be an issue to this day, while obviously cancer care is resuming. I think that there is a tremendous anxiety about people resuming not just active cancer treatment, but you're also starting to hear a lot of information about people and their need to return to cancer screening and what could potentially be the implication of cancer patients not being diagnosed with cancer at its earliest stage. In fact, there's some data from the National Cancer Institute that indicates that there could be as many as 10,000 additional cancer deaths, specifically linked to the fact that people have experienced a delay in their cancer treatment. I think that this is really alarming, and this is something that I think the entire community needs to commit to in terms of resolving these challenges. But specifically, when we think about you all in the pharmacopoeia world, I think there was some data that we did that I think is particularly right on point for you all. And it was perhaps one of the most surprising things that we found in our survey work to date. One of the biggest challenges that we have found so far is that cancer patients are having a really difficult time both finding and affording supplies. Again, I think this calls to mind a real challenge around the availability of supplies, the supply chain, and the affordability of those supplies. So if we look at the data on this slide, 40% of our respondents indicated that it was difficult to find food. Again, think back to every trip you have taken to the grocery store since March. I know I'm personally surprised that occasionally I will go to the grocery store looking for a fairly simple item and realize that it is not available when I go. I think that adds to a lot of anxiety. And then most importantly, looking at the light blue bars here, the difficulty of affording these basic needs. So I think we have a lot of challenges here in the food space that I think many people have heard a lot about. What's new to me about this slide is the concern about finding household supplies and protective equipment. So here you see that 81% of the people surveyed are having difficulty finding disinfectants and cleaners, paper products, whether it be toilet paper or paper towels. And again, a significant number, nearly 30%, are finding difficulty affording these products. Making sure that cancer patients have the ability to keep their homes and every environment they touch clean and disinfected is critical in their ability to go out and resume somewhat normal lives, even though it's a pandemic. And this is a huge challenge for them. You see that reflected in this last piece of data, which is around 70% of the people surveyed indicating that they had difficulty finding masks or gloves or other protective equipment. If you can think for a moment about what it takes for a cancer patient to leave the safety of their home, to go visit an oncologist, to go receive radiation therapy or any other kind of follow-up treatment, making sure that they have sufficient protective equipment is critical to their ability to feel safe when they leave their homes and realize that they will not potentially be infected by COVID-19. This is a very real concern for cancer patients and their families. Early studies indicate that cancer patients are 5 times more likely to die from COVID-19 if they're infected. So we know that being able to restore a supply chain that really simply allows cancer patients and their families to receive personal protective equipment and necessary household supplies around cleaning and disinfecting is critical to our ability to make sure that cancer patients can get the care that they need. So in closing, as we think about some of the key takeaways, what I would ask people to think about as you participate in this conference is that patients have a heightened awareness about the availability of their medicines, the quality of their medicines, and how they can prepare for the future. I think you will see many patients and many of the companies that you engage with be thinking about their business model in a very different way in light of this pandemic. Never before have I seen so many conversations about supply chain, raw ingredients, making sure that these systems are well tested so that these medicines are readily available to the people when they need them, but also making sure that the quality of these medicines is exactly what consumers, doctors, and patients expect. I think that we all have had concerns about making sure that the medicines that we receive are exactly what we expect them to be. And then last but not least, how can we use the lessons learned from this pandemic to prepare for the future? How do we make sure that we have a supply chain that ensures both quality and availability for patients? If I had one closing thought for all of you, it was that I think we have to use this pandemic as an opportunity to really think hard about how we have done our business in the past and how we can improve it going forward. Really making sure that we have prepared as much as we can for any future situation that arises, so that as we move forward through the next decades, that we're prepared for anything that will happen. so that in the future, I won't have to have the difficult conversations that I have had with cancer patients over the past few months about helping them not only battle their cancer, but survive a pandemic. I think, as we know, 2020 has been an extraordinary year, extraordinary good and extraordinary bad. I think it's critical that we all work together to make sure that we take as many lessons learned as possible. I really appreciate your time today. Thank you very much.
Thank you so much, Pam. I hope everyone enjoyed the presentation. We look forward to having you join us live Tuesday, September 29.